Thank you so much for letting me be here to join in this amazing program that has been put together, and every single person still sitting in a chair is phenomenal, because the fact you're still here past 4:30 is nearly unheard of in meetings, obviously. So from an ENT perspective, I have no disclosures, and the big thing here is we're trying to get older traditional practice of otolaryngologists doing large ablative head and neck cancer surgeries to actually form a consensus of how we manage our patients post-op. Every single one of our surgeons, we've got about 5 that practice head and neck in some variety and form, do a completely different pre, intra, and post-op procedure for how we manage our patients. And we said, we've seen what Dr. Young-Faydock has been doing in colorectal. We want those type of outcomes. And it turns out that actually a gentleman who we know well at this program, Dr. Dort, has been, since 2016, it's been published that there is an ERAS consensus statement for head and neck. And they've shown that it is improving patient outcomes. So that should seem easy. And everyone here who has dealt with all of their practice partners knows that that doesn't make it easy. We still don't agree on what we should do, and we don't like how you do it in our ways better, and show us your data. So that was where we came to how are we actually going to institute a new practice here at this institution that everyone's going to buy into in a department. And so you need that. You need the buy-in from all of the partners. You need it from the faculty. You need it from the mid-level staff who are actually rounding and seeing the patients day to day. You need it from the residents who are entering those orders on day one. But how do you do that? Well, we wanted them to, of course, understand the goals of our process, and we wanted them to feel like they had a voice in this process and make sure that what we rolled out was something everyone could get behind and was interested in seeing their patients cared for that manner. So we went through our goals, that our goals were to establish a current department norms that were going to be new and that everyone was going to be on board, and you could choose to opt out of parts, but that we would have something that we all at least moderately agreed to, and that this would be something that we would take for all of our head and neck patients moving forward. But how do you do that consensus part of having everyone feel like they actually bought into this process? I was pretty much told that if I had one morning meeting, I would be beheaded. If I sent out an email with primary literature attached, it would be deleted. And if I dared to send out an online survey, that was it. We were no longer friends. So I set up a mood chart, and I basically put together a couple of pieces of paper that had each of the consensus statements from Dr. Dort's paper, as well as some things that our department said they were interested in.